Welcome back to Good Day Chicago. You know, most people don't think twice about how to have a baby. That is until they can't. My husband and I tried for 3 years before we sought out fertility treatment. It wasn't an easy decision. There was the cost, but luckily we had insurance and the shots. Dozens and dozens of shots that I had to get to conceive. But obviously, as you know, it was all worth it. And today we are marking National Infertility Awareness Week with someone who can give us some answers to what's available for couples and individuals who really want children. This is Dr. Allison Rodgers with Fertility Centers of Illinois. I was actually a client of Fertility Centers of Illinois, and Dr. Kaplan there. We had quite the success story. Dr. Rodgers, how has treatment for infertility changed just over the past 10 years?
Actually, it's pretty amazing compared to generations before where people were maybe having babies earlier. We are today having careers, getting educated, and having babies a little bit later. It's pretty amazing that we are able to be so successful because the technology has advanced and really allowed us to identify problems in patients that we can fix and treat, and then also help them find success with healthy babies.
And the cost is such a barrier for so many people. Fertility treatments can cost more than 30 grand, and that is just to have one baby if you're successful. What do you recommend for couples who don't have insurance to cover the procedure?
Yeah, a lot of patients, especially in the state of Illinois, have employer-sponsored benefits. And companies like Progeny really help patients achieve financial ability to do treatment. However, in Illinois, there's a lot of ability to get coverage. There's also organizations like Chicago Coalition for Family Building, which is a nonprofit that gives grants to people who don't have insurance benefits. So there's a lot of opportunities to be able to get coverage, but it certainly is something that a lot of patients are worried about. I think more people have coverage than you would think through employer-based programs.
What is the success rate of IVF?
So obviously, success rates really can vary based on your age, health, and otherwise underlying fertility issues. However, for a young patient who is otherwise successful, chances of success with one embryo transfer can be as high as 65 to 70%. So very, very successful. And certainly some patients need more treatment than others. I also was a fertility patient, and Natalie, thank you so much for sharing your personal journey. I think it's really helpful for people to know that it's a scary time in someone's life to be facing infertility, but it can be very, very successful.
Absolutely. Well, I think people need to understand, you see pregnant women on television, and maybe you're at home struggling, and you think, wow, it was so easy for them. And that's why I encourage, my colleagues who had IVF or maybe had other issues to be public with it, because I think it helps people, they aren't alone, in their journey. Right? I also want to talk about egg freezing. I know a lot of women are doing this in anticipation of having a family later in life. How long does that process take, and how much does it typically cost?
So the cost is typically less than a typical IVF cycle. I want to say there's a lot of different range, but maybe in the $5,000 to $10,000 range. A lot of times this is covered also by employer-based programs and benefits. It typically takes about 10 days of medication. Like you said, they are injections. Most of those injections, though, are really small. They go under the skin. They kind of feel like plucking an eyebrow. So I tell people, if you can pluck your eyebrow, you can do fertility treatment. It's very successful. So the younger you are when eggs are frozen, the more success you'll have. So the higher the chance that one of those eggs can go on to become a successful baby. And those eggs can really be stored indefinitely. There's no expiration date on them. And we're very successful now in not only freezing, but successfully thawing eggs to go on to make healthy babies.
Such good news. And Dr. Rodgers, I want you to give the information about that organization one more time in case people missed it, that helps people who can't afford the treatments.
And this is a local organization that is run by local fertility doctors here. It's a nonprofit organization, and practices like mine at Fertility Centers of Illinois donate treatment cycles to this nonprofit organization. I also am able to sit on the board to help kind of give those grants to people. That's called the Chicago Coalition for Family Building.
All right.
And it is available. Grants are open soon, if not now, for this season.
All right. Thanks so much, Dr. Rodgers. We appreciate you.
Thank you so much.
Let's check back in with Kate.